Hello and welcome to the Physician Onboard training video. Before we get started, and as a reminder, please make sure to complete the attestation at the end of the video in order to receive credit for this training. A complete copy of this training will be available at the end of this video. Mercy Care services 6 different lines of business across Arizona. This integrated healthcare approach includes Access Complete Care, Regional Behavioral Health Agreement, Arizona Long-Term Care System, Developmental Disabilities, Comprehensive Health Plan for Children in Foster Care, and Mercy Care Advantage. Mercy Care provides care for members across various counties. For Access Complete Care and Regional Behavioral Health Agreement, we provide care in Maricopa, Gila, and Pinal County. For Arizona Long-Term Care, we provide care in Maricopa County, Gila, Pinal, and Pima. For Developmental Disabilities, Complete Health Plan and Mercy Care Advantage, we provide care in all counties. Today we are going to review these primary care physician responsibilities, which includes coordination of medical and behavioral health, early periodic screening, diagnostic treatment, healthcare effectiveness data and information set, health-related social needs, and Arizona long-term care. Primary care providers are often members' only source of treatment and support for behavioral health needs. That is why it's so important for providers to coordinate both the medical and behavioral health needs of Mercy Care members. Let's review guidance around coordination of medical and behavioral health and how to refer Mercy Care members to behavioral health services. Mercy Care must include psychotropic medications on its formulary for treating depression, anxiety, ADHD, and opioid use disorder. For opioid use disorder, providers should refer members to a behavioral health provider to deliver the therapy component of medication-assisted treatment. Providers must use validated age-appropriate standardized behavioral health screening tools to determine if further assessment for behavioral health services is necessary. Here are some examples of valid screening tools. A behavioral health provider can offer therapy, counseling or psychotherapy, support for mental health and co-occurring conditions, intensive services including psychological or neuropsych evaluations, trauma-focused care, and care coordination. A primary care provider should transfer a member to a behavioral health provider when they don't respond to treatment, have a behavioral health disorder, experience sentinel events, are at risk of harming themselves or others, or when you prefer not to manage their behavioral health condition. Call Mercy Care Member Services at 1-800-624-3879 to refer members for behavioral health services. During the transition, providers should help schedule the intake visit, share relevant health and medication information, and ensure the member has enough psychotropic medication for at least 30 days. Our next area of focus is early and periodic screening, diagnostic and treatment. These health visits are better known as EPSDT and are for children from birth through adolescence, with schedules adjusted based on health needs. Schedules differ for children in foster care or those with developmental delays. Within 30 days from removal, a child in foster care should have a complete physical, behavioral, developmental, educational, dental, hearing, and vision screenings, plus risk assessment, lead testing, and any needed specialty referrals. Ongoing monitoring is required to regularly assess the child's health, emotional well-being, development, psychosocial stressors, adjustment to the foster home, and visitation with birth relatives. If the child is 0 to 6 months, then they should have a visit monthly. If child is 6 to 24 months, they should have a visit every 3 months and over 24 months every 6 months. If screening shows developmental delays, then refer to an ASD diagnosing provider for an autism evaluation. Refer children 0 to 3 years old with delays to Arizona Early Intervention Program and to the Department of Developmental Disabilities as appropriate. Providers who have completed the access required training may be reimbursed for fluoride varnish applications completed at the EPSDT visits. Fluoride varnish applications can begin at 6 months of age, with at least one tooth eruption. Vaccine administration is covered at the EPSDT visit or any other visit if an alternative schedule is needed. Also, Mercy Care does not limit the number of well-child visits that members under age 21 receive. Healthcare Effectiveness Data and Information Set, or HEDIS for short, is a widely used set of performance measures in the healthcare industry, developed by the National Committee for Quality Assurance (NCQA). We are going to review measures for child, adolescent, adult, and by condition. Following HEDIS guidelines, provider conducts regular well-child visits, including physical exams, developmental screenings, and anticipatory guidance. Providers are responsible to ensure timely administration of childhood vaccines by the time member turns 2. Lead screening tests should be done by the age of 2 to detect elevated blood lead levels. As a reminder, verbal screenings do not count. Adolescent vaccines, including meningococcal, ZAP-TD, and HPV, should be administered by the age of 13. Providers should assess BMI and provide counseling on nutrition and physical activities. Adult immunization for our members occur from age 19 years and older. Following HEDIS guidelines, women should have a mammography and Pap. Members should have colorectal cancer screening. The next measures are blood pressure control and diabetes care. Providers should monitor and manage blood pressure for adults who have hypertension. And members who have diabetes should have regular HbA1c testing, blood pressure monitoring, eye exams, and kidney health evaluations. Follow-up is needed for member age 6 years and older after a hospitalization for mental illness. It is the provider's responsibility to conduct an initial prenatal visit to confirm pregnancy and assess health status. Member is to be followed closely to monitor fetal development and maternal health. The initial postpartum visit is within 3 weeks after delivery, with a comprehensive visit within 12 weeks. Providers are to monitor for postpartum depression and other mental health concerns and provide education on breastfeeding, contraception, and family planning. Let's talk about health-related social needs. Addressing health-related social needs is important for improving health and reducing disparities in health and healthcare. Providers should screen for housing instability, food insecurity, transportation assistance, employment instability, utility assistance, interpersonal safety, justice or legal involvement, and social isolation or lack of social support. The last topic we are going to review today is the Arizona Long-Term Care System and Care Coordination. Every Arizona long-term care member is assigned a case manager upon enrollment. Services are reviewed every 90 or 180 days using the person-centered service planning document required by Access. Providers are invited to participate in the care planning process. This may be done in person, emails, Outlook Teams meetings, or phone. It's important to note that members are not auto-assigned to a health home, but rather, select providers from across the network. Arizona long-term case managers work with the provider to coordinated medical and behavioral health needs. They are trained to identify the criteria necessary to make referrals for behavioral health services, SMI, and if special assistance is needed. The Arizona Long-Term Care Case Manager has a designated team of behavioral health clinicians, specialists, and pediatric case managers that they work with. Together, they have ongoing conversations about preventive services, developmental screening, and immunizations. Members with complex issues can be referred to Mercy Care's Care Management Program. A good candidate for care management are members who repeatedly use the ER for primary care, members with frequent hospitalizations due to poor control of a condition, members with a high-risk pregnancy, and finally, members with complex care coordination issues resulting from co-occurring physical, behavioral, and/or social needs. I would like to thank you for completing the Mercy Care Primary Care Physician training. Please click on the QR code for resources, a copy of this information, and to complete the required attestation. For additional questions, contact our provider educator.